for that?
February is Heart Health Month. We're getting ready a little bit early. Marcus Officer, who has the heart of a champion. He's live up at North Kansas City Hospital. What are you doing? Little stress test?
So I just finished an abbreviated stress test. They had to take it easy on me because of my knee. I got the knees of a 60-year-old, but they did strap me up all the way. You know, got the backwards gown on. Dr. Miller here, Nurse Jennifer helped me out with this. Apparently I have the greatest EKG he's ever seen. At least that's what I'm saying now because we can't correct it because it's live TV. But we talked about the last hour, Dr. Miller, just the causes of stress, what it can do to your heart. But how do you offset or try to avoid those types of situations for those that do have, you know, stress in their lives? How do you kind of avoid that?
Well, that's a good question. We try to do things that are helpful and healthy. First of all, avoid smoking, things that you don't do, but try to find something that you like to do. I recommend walking, running, some exercise that you do. Exercise is great. Hobbies, spending time with friends, and those kind of things to take your mind off of it.
But not news. You didn't say do news to do stress.
News is down the list a little bit, but your EKG fortunately looks great.
Awesome. Okay, well, maybe next year it might be a little different, but this is big month. I mean, heart disease, heart health is a big concern for a lot of people, male and female. Your biggest takeaway leading into the month, you're doing some free events so folks can do a stress test. What's your message to them about coming out or trying to find somewhere to go?
You know, I guess if you have risk factors, you should come out and get a screening test for heart disease. The other thing is be aware of your symptoms, and the third thing is spend some time for yourself and take some time for yourself to take care of yourself.
Awesome. Any other parting words of wisdom for our audience or Mark Alford as he tries to de-stress as well?
Fresh air, eat well, sleep well. That's all.
You should be okay, Mark. Good news there. Nurse Jennifer, thank you very much for making sure I didn't fall off of the treadmill. I'm keeping the backwards dress.
What did you have to do in that
gown.
stress test?
You might see me on air in this tomorrow. And so they change the speeds, change the elevations, they get you going, they try to push your heart as far as it can go. They push you as far as you can go, and then they have this fancy machine that pushes out all the information, and again, the greatest EKG right here.
What did you learn, Marcus?
Got it. I learned that the shaving process to put these strodes on is not ideal. I have a fresh, clean chest now, but I learned.
Well,
we've learned a
it doesn't
whole
feel
lot
good.
about
there
you
you go.
this
You know
segment.
what? That's to go. It goes right along with your head.
Save the best for last there. Now I'm thinking about Marcus's clean-shaven chest.
All even.
Yes. All right. Thank you.
Wow.
Oh, boy.
Wow.
What is